Welcome to another episode of Public Health Time Machine. We are a team of community health nurses that review public health cases and employ nurse thinking and interventions to increase awareness on topics by going back in time. Today, we visit the story of a woman named Imogene Henderson who sadly passed away on the streets of Calgary at the young age of 35. She suffered a life of abuse. Imogene experienced sexual abuse from a family member, resulting in an unwanted pregnancy and basement abortion at age 14. Imogene suffered chronic pain from the abortion, and that ultimately led her to turn to drugs as pain management. Turning to a life on the streets, Imogene was a sex worker, abused drugs and alcohol, and was often abused by her boyfriend. Imogene sadly passed away after her 35th birthday from an opioid overdose. Turning back the clock, Imogene is an 11-year-old who lives at home with her mother, father, siblings, and often her uncle. Imogene's father is the sole provider in the family and often physically abuses her mother, leaving her withdrawn and stuck in bed all day. Her uncle often stays over to watch Imogene and her siblings. However, he's been sexually abusing Imogene for the last few months. Imogene loves to go to school, and her 5th grade teacher, Miss Smith, has taken a particular interest in Imogene. Imogene often complains to her teacher about chronic stomach aches and lately has become more reserved. Imogene felt safe enough with Miss Smith to confide in her about her dad's violence against her mother and more recently shared the sexual abuse, prompting Miss Smith to file a report with the authorities. Without early intervention, the trajectory of Imogene's life may shorten significantly. We as community health nurses will dive deeper into Imogene as a child to find ways that the tragic story could have been avoided.
Hello, Miss Smith. I'm a community health nurse, and it is my understanding that you are Imogene's grade 5 teacher. Could you please, from your perspective and experience, describe some of the characteristics that you might notice in children who are experiencing a distressing home environment?
Hello. Thank you for having me on the show. I usually keep an eye on the trends of students, such as absences, mood at school, how engaged they are in the class, and how they look physically in terms of clothing and overall healthy appearance, whether they bring a lunch every day, and if they are interacting with their friends.
Okay, thank you. We do know that inadequate nutrition does in fact impact a child's ability to learn and develop properly. In addition, the school environment is one of the most important environments that provide children with physical, emotional, and social support aside from their home environment. Have you seen any of the signs that you mentioned in Imogene?
Yes, unfortunately, Imogene has come to me several times now with complaints of chronic stomach aches with no apparent cause. She also only brings lunch a few times per week. However, our school has a good lunch program that she utilizes when she does not get a packed lunch. We also noticed that Imogene stopped playing with her friends at lunch. At the beginning of the school year, Imogene was really enthusiastic. She loved to read and engage with other students, but over the year, her grades have slipped and she has become withdrawn.
Okay. We know that there was a complaint filed to the authorities, which has resulted in an ongoing investigation by a social worker. Could you tell us if you noticed anything about Imogene that might have prompted someone to notify Child Services?
Yes, we did notice a few signs. The teaching team had noticed some bruises on Imogene over the last couple of months, and her overall demeanor changed. And when I had private conversations with her, there was plenty of reason to seek further support for her. And when you look at my role as a teacher, we are really important people in their lives. And I have a duty to report anything that has been disclosed to me that could harm the child.
Well, thank you for your time. It's teachers like you that change the trajectory of children's lives when they pay close attention to what is going on outside of school. Hi, Lucy. It is my understanding that you are the social worker that has been assigned to Imogene Henderson's case. Can you tell me a little bit about anything you've come to know about Imogene and her family based on your initial assessment?
Hi, yes I am. From my initial assessment, I could see that Imogene was suffering from toxic stress, which can result from long-term exposure to an unhealthy home environment that includes addiction, depression, and violence. From speaking with Imogene's teachers and meeting her and her mother, I had reason to believe that Imogene was in an unsuitable home environment, and her support network was unstable and unable to provide for her needs and protect her.
Okay, thank you. Could you tell us what might happen if there were no interventions put in place in a child like Imogene's life?
With no interventions, Imogene could become susceptible to further stress and poor outcomes later on in life, such as substance use disorders, which could lead to overdose and death, alcohol and drug-induced illnesses such as liver disease, homelessness, injuries, further abuse and partner violence, unprotected sex resulting in unwanted pregnancy or sexually transmitted infections, engaging in survival sex, and working in the sex trade, which are all dangerous to mental and physical health.
You mentioned that Imogene's support networks were lacking stability and capacity to care for Imogene. Can you tell me a little bit more about that?
Imogene's mother is experiencing intimate partner violence within the home, in front of the children. Unfortunately, women are among those who experience the most serious forms of intimate partner violence and commonly become injured and suffer from negative impacts on their mental health, sometimes resulting in post-traumatic stress disorder. In order to protect Imogene and increase her quality of life, it is my recommendation that we should also intervene in her mother's life. It is important to note that there are many possible causes of family violence. However, there are strong correlations between the social determinants of health, such as income, social status, housing, and food insecurity, all of which are affecting Imogene's family. These elements place a tremendous amount of stress on families, often leading to violence in many forms.
The knowledge you shared with us will help guide our interventions going forward.
After gathering information from our initial interviews, we decided to summarize our findings using a SWOT analysis in order to inform our planning moving forward. In regard to strengths, we know that Imogene has a supportive environment in her school. Her teacher has shown that she is attentive to Imogene's needs and has taken steps to prevent ongoing abuse in the home by reporting it to the authorities. Additionally, her teacher's comments show that Imogene has proven to be an enthusiastic and bright student in the past. In terms of weaknesses, we know from Imogene's teacher that her interest in school has dropped recently, and there is also reason to be concerned about her nutrition at home due to her reliance on the school's lunch program. This could be a result of either abusive conditions or financial stress within her home. In regard to opportunities, we know that although Imogene's interest in school has dropped recently, she was formerly a strong student. We also know that some of her basic needs are not being met at home, and we suspect that if these needs were met, she could focus on higher level needs such as her education and have a strong academic future. Finally, in regard to threats, we know that Imogene is still living in an abusive household, and because of this, she is under constant mental health stress due to both direct and indirect abuse at the hands of her uncle and father respectively. This household stress also threatens her educational development, as we have seen that both her interest in school and her attendance have decreased. Food insecurity and potential malnutrition also contribute to potential barriers to her development, both physically and mentally. Additionally, studies have shown that adverse childhood experiences in the home can place her at an elevated risk for homelessness and substance dependence as she grows into an adolescent and an adult. After reviewing our assessments of Imogene, we came to the following nursing diagnoses to guide our planning. First, Imogene is at risk for poor mental health and inadequate nutrition affecting her development due to an unstable housing environment and exposure to family violence, as evidenced by her change in her school motivation and her reliance on school lunch programs to meet nutritional needs. Additionally, Imogene is at risk for inadequate social supports and poor health coping skills surrounding physical and sexual boundaries due to unhealthy home dynamics, as evidenced by physical, emotional, and sexual abuse experienced in the home.
Our first intervention is a short-term emergency housing intervention for Imogene and her mom, Sally. We, the community health nurses involved in Imogene's case, believe that to help Imogene, we also need to help her mom. We believe that connecting Sally with an emergency women's shelter is a good place to start. The Calgary Women's Emergency Shelter offers a place of safety and support for women and children experiencing domestic abuse. The shelter provides women and their children with a safe and comfortable room, food, toiletries, clothing, counseling sessions, resources for steps forward after leaving the shelter, safety planning support, and a court case coordinator to help survivors navigate the legal system. This is a tertiary level CHN prevention as it addresses an issue that has already occurred and is focusing on improving the quality of life of Imogene and her mother going forward. The emergency shelter, however, is a short-term goal that we have identified for Sally and Imogene. YW Calgary is a women-centered foundation that offers support, resources, and housing to women and their children who are experiencing homelessness or fleeing domestic abuse. One program offered by YW Calgary is the YW Taylor Family Home. The YW Taylor Family Home is a long-term housing support for women and their children who have suffered from domestic abuse. Not only will the program offer safe, stable housing for Sally and Imogene, but it will also offer them trauma counseling and access to their Women's Economic Prosperity Program, which supports women in building the skills and knowledge required to empower them to enter the workforce, which will ultimately give them financial stability, independence, and well-being. This is a tertiary level intervention, as it is a downstream approach that focuses on supporting Imogene and her mother through their healing process.
Our next intervention is aimed at developing personal skills for Imogene and her peers about safe adults, inappropriate behavior, and how to report sexual abuse, which will give her the confidence and tools to advocate for herself. Additionally, it will foster a safer environment by creating awareness of sexual abuse and inappropriate behavior. Prevention training programs have been effectively implemented in college sports settings and can be adapted to Imogene's age and context. In this way, Imogene and her peers can prevent poor long-term health outcomes such as unsafe sex, substance abuse, and further abuse. Since this implementation brings awareness and education for children, it can be considered a primary prevention that targets the community level because it is taught to schools. Additionally, prevention programs adapted for teachers can increase the safety of Imogene's learning environment and within the community. The training program can inform teachers how to look for symptoms of domestic abuse within their students and how to approach them in confidentiality and how to report incidences without putting the student at risk. The Calgary Women's Shelter has started providing a similar training program for educators, incorporating the Calgary Board of Education, Calgary Catholic Board, and Rocky View Schools. Extensively, prevention training programs can be adapted to many contexts within the community that are outside of the classroom, such as safe sport for coaches, staff, and athletes. This intervention targets teachers at the level of the community, and this is considered a primary prevention to decrease fatal outcomes from domestic abuse.
Using the population health promotion model, we will examine how the social determinants of health, such as early childhood development, income and social status, and supportive environment, played vital roles in Imogene's life and her health outcomes. First, early childhood development. Early childhood development includes the earliest years of a person's existence, which are thought to be the most crucial for development, as they impact the life course and developmental trajectory. For Imogene, growing up in a household where family violence existed impacted her psychological well-being and set the stage for future adversities. Childhood abuse increases the likelihood to develop depression, anxiety, internalization and externalization of problems, sexualized behaviors, and post-traumatic symptoms. Next, income and social status. Socioeconomic factors such as economic hardships can contribute to higher level of stress, as seen in Imogene's case. Additionally, financial constraints may have made it challenging for Imogene's mother to leave the abusive relationship and seek safety for herself and her children. Lastly, social support networks. This includes support from families, friends, and communities, especially in times of change or stress, and it determines how people solve problems or manage stress. In Imogene's case, her parental figures were unable to adequately provide support and protection and did not exemplify a healthy relationship. This lack of familiar support heightened her vulnerability and increased her susceptibility to harm. The social support that Imogene acquired outside of the home through her school provides Imogene with a trusted adult that advocates and supports her needs. As mentioned in the interventions, our action strategies exist at a community level and family level. The housing interventions that we suggested align with the family level of action, and educational programming align with the community level of action. In addition, we aim to create a supportive environment via safe and stable housing, as well as trauma counseling services, to provide Imogen and her mother with coping mechanisms. At the community level, we will develop personal skills through educational programs for students and teachers to help children identify safe adults and to provide teachers with tools to identify and report suspected cases of abuse outside of the school.
Following the implementation of the interventions, a comprehensive evaluation plan is required to ideally reveal significant progress and positive outcomes for Imogene. Follow-up meetings between the community health nurses and Sally would be required to assess the quality of support that Imogene and Sally are receiving in short-term and long-term housing. Further, Sally has also been connected with resources tailored to address past trauma, facilitate healing, and foster economic stability through the services offered by YW Calgary. We would also follow up with Sally to assess the success of the counseling services. In regards to Imogene herself, we would follow up with Mrs. Smith, her teacher, to evaluate her current status in the classroom and identify if her mood and motivation has improved. After educational programs have been implemented, we would assess Imogene's ability to demonstrate her knowledge and awareness regarding safe sexual practices, substance use, and recognize abusive behaviors. We would touch base with teacher again to determine whether rates of family abuse reporting have increased within the school system as a result of the educator training to identify signs and symptoms of abuse. This underscores the efficacy of the interventions in creating a culture of awareness and accountability within the school systems. The comprehensive implementation of these interventions would have the potential to improve the safety, well-being, and empowerment of Imogene and her family, while creating a broader culture of support within the community.